Welcome back to the Mobility Project. We're here in Colorado visiting my parents, and a question has come up from one of our friends who's had a little bit of a back tweak. And oftentimes when we're deadlifting, when we're squatting, we're training heavy and we get a little bit tight, or we mobilize in a strange position, we end up with kind of classically as a pelvic fault. And most of the back injuries I see kind of result in kind of two categories. One is an overextension injury, where I have one segment kind of hyperextend on another segment. And when that happens, your body goes into shutdown mode. It basically sets up a series of spasms in that back. Your longissimus kind of gets turned on, your psoas gets turned on, abs get turned off, you get tight, you get walking in, end up with kind of default man belly. That's common. Either way, that or with this other kind of common fault, which we call a pelvic fault. And what you end up having is a little bit of a rotation in one of the innominate bones, one of the kind of pelvic bones. And it's very common to have a little bit of rotation or an upslip. And what you don't need to know is kind of how to correct that so much, but there are some very basic techniques to identify when that happens. And either way, with either the kind of the overextension fault or the pelvic rotation, you end up one side. On the other side, you create a little bit of shear in your back, or your back end experiences kind of a mechanical shutdown. So what we're going to talk about today is this kind of pelvic fault or pelvic obliquity. And what ends up happening is when I end up in that position, you can see if you test someone by having them just kind of do a manual test or lift, and then you have them put their foot up on something, even if it's as high as something like this, you'll see that that body will experience a great deal more shear, and you'll see an immediate default and shutdown in force production. This is why when people are doing strange things with their feet when they're squatting, we see kind of big output changes. All right, so here's the deal. When we end up with this kind of pelvic rotation, one of the things we want to do is it ends up feeling like you're jacked, psoas gets tight, longissimus turns on, you can end up getting kind of shooting pain down your butt. This is classically pathognomonic for L4-5S1 dysfunction through here. What we need to do is restore motion in your pelvis. If you're having a problem, go get some help. Go see a physician, go see an osteopath, go see a physical therapist. But understand that you should be able to try to unwork this yourself and restore motion. So either way, you're going to have to do this. One is break the spasm. Get on the ice. Restore motion in those tissues. Those spasm tissues are causing a lot of the pain. So what we want to do is roll around on the ball in the longissimus, here, along the back, then all the spasm in QL. Get into the hip here, especially hip flexors. We want to also treat the psoas classically in that SI dysfunction. But then there's a couple other things we want to do. And what we're going to do is we're going to hand the camera off to my mom. I'm going to show you a couple things that we look at when we're seeing this problem. Okay? So take a look at this. So I've got Juliet here. And one of the things that you can see is that if you look in the mirror on yourself and you notice that these two big bumps around your pelvic bone here, this is your ASIS, your anterior superior iliac spine. What you can do is you can just palpate on yourself. And you'll notice that as I just run my hands here, this is not a diagnostic, but if you notice that one hand is about an inch higher than the other, that's a classic tell of that you've got a little bit of rotation. So in this situation, obviously Juliet doesn't have any back pain. She's not feeling tweaked in her pelvis level. In the back, turn around, Jay. Same thing happens. There's a couple of bumps in the back. The posterior superior iliac spine's right here. And if you'll notice that on her that they're level, and then a simple test that we do that you're not diagnosing, but it's a movement problem, is that if I put my hand in the middle and Juliet picks up her right knee, that rotation happens. Pick up your knee again higher. My thumb drops down below the other thumb. On this side, she stands on the right leg, picks up her left knee, and what we've got is tells us that our rotation in those pelvic bones is working correctly. It's a simple test. Again, these are simple things. One of the things that you can do if that happens, again, we've got to break the spasm. We'll go ahead and hand that camera back off. Is a simple kind of common rotation, counter-rotation thing. This is kind of classically Julie Sarmon. What ends up happening is I'll bring both knees to chest. I exhale, pull my belly button to spine, get tight and stabilize my spine, back is flat. I push in one hand and I pull in the other hand. What's happening is I'm using my hip flexors and my hamstrings to generate a little rotation force in that pelvis. And then I unload and I switch the other side. I do about 5 seconds each side. If you don't have any problem, this won't hurt you. If this hurts you, your face goes numb, stop. But all you're trying to do is use your musculature to reset your position of your pelvis. I alternate back and forth a few times. This is a really good way when you have a little back tweak to try to undo yourself. The second thing you do from this position is grab a pillow, fold it up, big breath, belly button, spine, and then squeeze hard. You might get a little clonk in your pelvis. That's your pubic symphysis reorganizing itself. Big breath, exhale, belly button, spine, squeeze 5 seconds, and you can repeat that, trying to use your own musculature to restore that motion. One of the other things that we can do is use our little band in here. Use my jump stretch band. What I can do is wrap it around my ankle here and just get a little gentle distraction. Most of the time when we have a leg feeling jammed up in the socket, lay down here, if I just create a little bit of traction and relax, it distracts that hip out, allows me to get some rotation, a little bit of movement, and then I can just even squeeze my butt. I can do a little bridge here. I can change the angle, but all I need to do is just relax. A little bit of distraction here, long force through the femur, pulls it out a little bit, and this is a common way to unload myself from a little bit of extension. If this hurts a little bit, I can even go aim this a little higher, pull it into a little bit more flexion, but the bottom line is that I'm getting this hip to distract out so I can remove that load or that jam and get myself moving again. So, ice that thing like a mofo. If you're having a problem, you can't ice, you can't break the spasm, you can't restore your motion. That's why I remember all of the West Side guys do so many of the reverse, I guess it's a reverse hyper, that's right. If you can't do those things, go get some help, go see a physio, go see a chiropractic. But in the meantime, understand what's going on with that shear. Make sense? We'll see you guys tomorrow.